Aloha, my name is Parjiana, and tonight I'm going to talk about PTSD, the symptoms and frequency and treatment. So PTSD is a disorder that needs to be taken right off and treated as early as possible before it breaks the person. So what is PTSD? PTSD is post-traumatic stress disorder, which occurs when a horrifying event happens to an individual and causes the trauma. And it's a response of fight or flight. What is fight or flight is that, imagine right now, the door smashed open and a wild, hungry tiger jumping. What would you do? You would run, right? This is a response that we actually, a million years ago, when we were living in dangerous places out in the wilderness, we created, and as a coping and secure survival mechanism. So we're going to talk about symptoms and frequency and treatment of this disorder. By the way, this is not a disease, it's just a disorder. And this disorder is not curable, but treatable. So what we're trying to do is to make sure that we treat this as early as possible. So before that, I'm just bringing this picture named Vulture by Kevin Carter, and it's in Sudan. And Kevin Carter is a photographer from South Africa, which committed suicide at age of 33. And the reason was that he was exposed to so much trauma, both as apartheid in his country and then as a news person in around the world. And then he was broke financially. And then he basically, his closest friend got shot in by peacemaker in an event, because he was also a photographer. And he drove to a place where he was playing as a kid and commit suicide. So his letter, this is what is his letter, suicide letter, talks about the trauma, the hunting pictures of corpses and horrifying places that he was there, and that he was broke, and that his wish to join his friend Ken. So he was not bodily, physically exposed to that, but he was observing all these, and that's what it is has happened. This is one of the causes of PTSD. You don't need to have this happen to you, but you can observe all these. The other causes are natural disaster, wars, accident, car accident, rape, trauma, torture, mugging, child abuse. So we want to see, talk about symptoms. So what are the symptoms? The National Institute of Mental Health, NIMH, put this together as mind and body, the causes, the symptoms, and then put it both together as a soul, the symptom as soul. And that's what actually Kevin was exposed to this, and he took his life because he couldn't see any brightness. And his problem was nobody detected this disorder, and it was not treated early for him to be able to rescue himself. DSM, this is a professional work that all the professional have to use to diagnose the patients to get the insurance money. Added also these symptoms to PTSD. So next one is the frequency. In my interview with Dr. Lucy Jones, who's in our college, nearly 8 million people are in United States affected by this, including children and women and men. And women are more exposed to that than men because of the anxiety. Plus, that children can bounce back faster if we get to them earlier. That's why those school shot, when it happens, school shootings, the psychiatrists and psychologists, they just run to the to children and start their treatment very early. The other one is the chart here that shows the occurrence of that. We see that the children get 50% of that child abuse, while the police has just 13%. That's the lowest, in spite of having such a dangerous job. But the difference is that they are trained and ready for the job that they are doing, and they know what they are facing and how to cope with it. So the next one is the treatment. What are the treatments? There is a treatment with medication, which they try to slow down the half right of the brain, which anxiety and all the stress happens there. By that, we like Seroquel and Zoloft, those, and then there's therapy, which is like a talk therapy, meditation, self-hypnosis, yoga, tai chi, that kind of therapy. There is two others, which is eye movement and I'm sorry, CBT, cognitive behavioral therapy. That both of them, they try to desensitize the whole memory and symptoms of PTSD by talk through it over and over and over again, or to re-experience the whole event in surrounding that is like the place that whatever happened, or go directly to that exact place and re-experience the whole thing. And by doing that, actually, I'm sorry, the patient can detach him or herself from that memory and replace these negative memories with positive memories, bring it there. And therapists basically want to take the clock and take it back, to turn it back to when nothing happened, before that whatever happened. So they go there. This happened to me because I have PTSD and I am disabled, permanently disabled with that for 14 years ago that happened. And the most effective one, so I went through all these symptoms and treatments. And the best one was exactly to talk about it and go there. The moment I went there to the same alley and parked my car in the same parking spot, and I was able to come out and go to work, everything was stopped. Everything really stopped. And I was able to somehow be functional slowly and go back to a kind of normal life. And that's about 14 years ago. I mean, it comes back a little bit here, there, depends on, but I can cope with it. Now, I have tools. And that's the whole thing. So the other thing that I I interviewed and find out was a local PTSD treatment. Dr. Bosan from Lokahi Treatment Center, which I volunteer there, told me that in year 2000, Uncle Bob took 12 Navy snipers to Sand Beach, to Black Sand Beach, and including one of them was his nephew. And they were going there every week and planting coconut trees. And by doing that, they were doing a therapeutic treatment. So these are the way that we are going back to wrap it up, is that the whole thing is about not to let the PTSD break you, but get into that as fast as possible through counseling and helping to get back to the normal life, kind of normal life, and be functional. So if you have any questions, please let me know. Otherwise, I thank you for coming here and listening to my speech.
Thank you.